Kiran Shaw to open this. The resumes are all on the portal, but I would be missing my point if I didn't say that she's one person who is multifaceted, healthcare visionary. I've known her for 3 decades. But then I would also say that everyone who meets, when I meet them, they always say Kiran is a friend. So she's very accessible. But she's also one of the few who speaks her mind openly and people listen. So Kiran, we are here to listen to you.
Thanks, Som, and it's a pleasure to be here on this panel. And let me start by saying that it was a very interesting panel that preceded this one. And whilst all of us are extremely keen to see the success of the National Digital Health Mission, we also know that there are daunting challenges, because I think what we need to understand is that if you talk about equitable healthcare, if you talk about access to healthcare, then we have to make it work at the bottom of the pyramid. So I think what tends to happen is that when we look at digital healthcare, we are only thinking about that small part of our population that is digitally savvy. When you hear all these things, people need to know everything about how to use a device, how to download things. But you know that a large part of our population, 66% of our country, lives in villages. And not everyone has access to smart technologies. Not everyone is educated and tech savvy. So I think we need to focus on how do we deliver healthcare to this strata of our society, which is the biggest strata. And there I think we have very, very interesting opportunities. For instance, I do believe that it's not just about digital technology per se, but it's also about medtech. So we need to combine the two in a very intelligent way. Secondly, we have our army of ASHA workers, our health assistants. They must be enabled into technology assistance, because that's the only way I see the interface taking place. And I draw an analogy with our unified payment interface. The way we've made digital payments work is incredible. And I think it's very gratifying to know that in the month of August, we have had almost close to 2 billion transactions on our UPI, which tells you that something is working. And why is it working? Because we have business correspondents who make sure that the people who need to access the unified payment interface are assisted. So I see a big role for ASHA workers to play that technology assistant or technology interface role as, providing that assistance to the rural person who needs access through digital enablement. So that's the first thing I think we need to work on. And I think this is a huge career opportunity and a job creator for just our ASHA workers, to get them from a basic level of understanding of technology to a more advanced level of technology, which needs to be skilled and they need to be educated and skilled through, again, digital programs. So I think there's a huge opportunity for this technology-led medical education for the ASHA workers themselves. Then I think we need to make sure that we have a understanding of how do we use our, it's very complex. Our ecosystem is very complex. On one hand, you have the primary health centers, which are state-run. And now we're going to have our wellness centers, which are going to be run by the Ayushman program. I'm very excited by PMJ and the Ayushman Bharat program per se, because that's where you can actually roll out nationally at least a semblance of a unified digital healthcare mission. And then we have to see what is the role of private sector, because I feel everyone has raised this issue of private sector has a very important role to play. And I think there has to be a very strong understanding of the roles and responsibilities and the regulatory governance around the private and public sectors. That is going to be very, very important. And I, for one, believe that when you look at upgrading the rural infrastructure for medical healthcare, it's not going to happen by the government. The private sector has to play that role. But then how do you make sure that the private sector is basically compensated for investing in creating this upgraded infrastructure in healthcare. For instance, let's assume that you need to create more sophisticated centers which have MRIs and scans and what have you. Who's going to invest in that? And if private sector is going to invest in it, how are you going to make sure that the compensation that they get for delivering these services are going to be equitable? And how are you going to make sure that is not going to be misused? So you need a good thinking around governance, around the financial modeling, around the role of technology in delivering equitable and affordable healthcare, and about the citizens' role in getting a pull rather than a push. So I think there's going to be a lot of interesting challenges which we need to conceptualize. We need to make sure that we get into concepts of e-vouchers and many other things, Som, which I feel will make a big difference to making this happen. But I'm actually thinking a lot about it. I'm in fact involved in a Lancet commission where many of us are involved, and we want to really brainstorm to see how we make it a reality. It's not easy, but I think we can put our heads together, and it will take everyone thinking about it. It's not my idea. It's not one person's idea or two people's idea, because there are going to be a lot of challenges. We talked about privacy and how we're going to use the consent system. How are we going to ensure interoperability and portability of data and documents? So I think all this is a very important part of healthcare. It's really about understanding the continuum of care. So what happens to a normal person? You have symptoms. When do you ask for that, when do you go to a hospital, or when do you consult a doctor? When the symptoms get worse, but you don't want that. You want an early detection of symptoms. So how do you promote that and create that awareness? So I think you have to look through the whole continuum of care and see how you can diagnose early, treat early, and get better outcome. And for that, digital technologies can play a big role. But I think this panel discussion is going to be too short to discuss all that. But all I would say is, yes, I think there is very exciting things happening thanks to COVID, where you've got telemedicine happening at a much larger scale than ever before. You're having e-pharmacies finally becoming a reality, and we need to leverage e-pharmacies in a much better way. But what technology does offer you is to have checks and balances and traceability and trackability. So let's use all that for good governance. So I'll end there, Som, because I'm sure other panelists would like to say many other things.
Yeah, thank you, Kiran. This was wonderful. And of course, we're going to come back with you and pick your brains on some of the key issues that we have. But, I was quite touched with something that you mentioned about private-public partnership. And there, I think there is this word called trust. And I think today the trust deficit, if we didn't build it, then it's not going to work, because we have to work. And I was very happy to see Dr. Indu Bhushan saying these are the areas for the private sector. But I think there is a bigger role that we will have to play to have it delivered. I also picked up on about your thing about the villages. And I think hopefully the BharatNet, which is taking the fiber to all the villages, also gets integrated. This is an opportunity that we have of making healthcare real. And I think that has been the topic for the last 5 days, if I include today, as deliberations. So we cannot miss this opportunity, and we have to make this happen. I think all of you spoke about one topic, and I really want some answers. So, I'm probably the only odd man out because I don't come from healthcare. But, when we keep talking about these numbers and what we need to do and digital costs, how are we going to make it affordable? We have, on one hand, the government saying, and we're going to put pricing controls on everything, the cost of healthcare, all these new devices that are going to come up are not going to be cheap, right? The networks are expensive. So how do we ensure that we make these investments, they are affordable, and at the same time, they are sustainable for the healthcare providers to be doing this? Kiran, you want to take a shot at it?
Yeah, so I really think it's about, preventive healthcare, early detection, and really looking at our own strengths in delivering affordability when it comes to innovative solutions. Because I really believe, Som, that in many, many ways, India has come out with very affordable solutions, whether it is generic medicines, whether it's vaccines, whether it is medical devices, whether it is anything that you can think of in the healthcare sector. And again, I believe that there's a very important point raised by Dr. Gyani, which really focused on the human resource element. And we need to use technology to bridge a lot of this deficit by actually upskilling the many of the human resources who are not essentially qualified at a very high level, but actually looking at how to skill them, how to technologically skill them and make them use technology to deliver that access and affordability in a very effective and optimal way that gives you better outcomes. So for instance, we talk about ASHA workers, we talk about nurse practitioners. Today, of course, the Commission of India has actually come up with these diploma programs that will get you many more specialists. And all this is going to actually play a very important role, because it cannot be business as usual. We have to think out of the box. We have to look at all the resources available to us and see how are we going to network them to deliver this affordable healthcare, which I'm very confident can be done if we don't wrap ourselves in regulations. We have to actually deregulate a lot of what we have today to allow a lot of people to be key stakeholders in delivering healthcare.
Thanks, Kiran.